welcome to one more episode of Drug Discovery and Development with Ioncure. I'm Sukant Khurana, the founder of Ioncure. With me is Vanshika. Vanshika is a brilliant young student who's studying drug discovery at University College London. I want to discuss an important issue which is very close to our heart, is role of women scientists in drug discovery. Because I've been to several drug discovery conferences, I interact with my peers working in the same field, and something that I realized, despite the number of masters and PhD students being very high in terms of women and men ratio, there is a paucity. And I think it's a result of two things. One is a bias in hiring. There is a bias against women. There is a bias against minorities. People need to look a certain way. People need to talk a certain way. Men keep getting preference, which is problematic. There's even a bias of certain personality traits, which honestly do not matter in R&D. So, uh, what is needed actually, even in terms of broader mindset diversity, not just a gender diversity, is the idea that you bring in people from various streams, and that kind of thought process has been missing. Because if you look at what created America, were a bunch of rebels, a bunch of mavericks who created, I think, one of the best places on earth. And it took a lot of questioning. So that questioning in a corporate structure has been missing. So despite there being, one of the best researchers being women, a lot less go to the top. The other is male chauvinistic patriarchal system. So I saw despite my father claiming to be a leftist, in fact, he was very politically active leftist, but we saw our mother struggle. She carried the home on her back. 90% would be an underestimate of what she did in home. So we won't be doing this. I won't be making any difference to the world in terms of drug discovery if it wasn't for my late mother. But women tend to carry the burden of household on their backs a lot more than men do. So these are two factors which are holding women back. What do you think? Sorry, I gave a long spiel of what I think. I mean, without sort of using the label feminist, I'm a very strong feminist. So, and I mean, for my father, it was such a big contrast coming from an Indian family that why do I cook? Like, not just survival cooking, I enjoy cooking. So the ideas of male, gender roles is so hard ingrained in the previous generation, and that results in extreme problems. But this is a topic that's really dear to me. I gave you my perspective before asking the question. But as a woman scientist, what are the things you feel are holding women, and what can be done to systematically promote women who are deserving?
So, apart from being a woman scientist, the other thing that I'm definitely is a woman of color. I am a woman from a smaller city, from a place which is definitely, I believe, even underrepresented in the maps. I come from a very small city called Banaras, from India, and reaching UCL or a destination like London, United Kingdom for that matter, was a huge achievement for me, and not just for me, but for my city as a whole. Because, when you come from a city and you're a woman, there are two different kind of views about you. That firstly, you're coming from a smaller city, so your family must have a really narrow thinking and a very conservative mindset. So, you will definitely not be outgoing. You might not be great at speaking to new people. You might not be good at interacting. Then the other thing is that you're a woman, so, you must have a level of shyness or coyness that you're supposed to show when you're talking to other people, so that you might not come as too aggressive or too opinionated, which is the first thing that I think is what women think about before they
Yeah.
talk. So when we are talking, we always have to be careful of what words we are using, where we are talking, how we are, sort of showing our hand movement, what kind of personality we are, displaying in front of the people, so that they don't get the wrong message from us. And I think that is another important thing that definitely holds women back. The other thing is that I believe that in developing countries, mostly the problem exists. And the thing is that there are women who have been taught since the age of, they were not even women then, they were just girls. and they've always been taught of things such as, if you have an opinion, just keep it to yourself. If you
Mm-hmm.
feel that you are capable of achieving more than
Yeah.
a guy, don't ever say that to anybody else that, he's a guy, so he's getting more. Don't point it out. Just let it
Mm-hmm.
be, which I feel is extremely, extremely poor thinking.
Mm-hmm.
Especially in times like these, where we are seeing
Mm-hmm.
women reach the pinnacle of all sorts of fields. There are
Mm-hmm.
women such as Nurulan Zaveri. She is actually the founder and CSO of Astria Therapeutics in the United
Mm-hmm.
States. Um, she realized the intensity of this kind of a problem, and she actually wanted more women to take risks, to be bold about their career choices, and
Mm-hmm.
to come up and come front in the field of drug discovery and
Mm-hmm.
being as researchers. And so she started a symposium called Women in Pharmaceutical Sciences, which I think is a great initiative. And I also feel that Indian women scientists should also, follow the same lead and maybe start something of the sort, so that women who are mostly underrepresented in a country like India should also have access to these symposia, or maybe ideas mostly, that, they do have the right to go ahead and be what they want to be, instead of the society telling them what they have to be. So
Mm-hmm.
I feel that's something that's really important, that women altogether, they should just, I mean, form a conglomerate or anything and form a union, just get together and talk about them participating in science, and not just the regular feminist themes that are discussed
Mm-hmm.
otherwise, in terms of feminism, which I am definitely in favor of. But I still
Mm-hmm.
feel that, when we talk about feminism also, science is one thing that is always left behind, because even in feminism, it's mostly about how women dress or how women talk. Nobody discusses about the fact that how women are educated, how knowledgeable they are, or how much access do they have to education of higher levels. And,
Mm-hmm.
in fact, I know so many of my own friends who are absolutely brilliant at what they do, even in terms of science. They are great. They will definitely prove to
Mm-hmm.
be great researchers someday. But just because of the fact that they are women, their families, say that ultimately you have to get married and you have to stay in India. What is the point of leaving the country and going somewhere else to study?
Mm-hmm.
Which I absolutely fail to understand. But I still feel that there is definitely a need for people to realize that not just men, but women should be allowed to do whatever they want to do, because at the end of the day, I still feel that they might have a lot more potential than they are shown to have right now. And the future definitely awaits for us to see brilliant women researchers in the field of drug discovery and in all other fields of science.
Wonderful. So, Vanshika, I am even more impressed and inspired by you. So, absolutely impressive perspective. I'm sure you're going to kick ass and maybe one day run your own company. We'll be remembering this time fondly that you helped build Ioncure and you helped beat SARS-CoV-2 crisis fighting with us. So we are glad to have you in trenches with us. So absolutely brilliant perspective. Let's sort of end the call by telling one small fact about the Ioncure. We conducted a project where we got information of several hundred women scientists, and we created a database which is slightly less than 1,000 at this moment, of women scientists, and not just their scientific achievements, their personal journeys, how they accomplished it. And we did not include the examples which everyone knows. Obviously, there are admirable examples like Rosalind Franklin, right, Marie Curie. We looked at examples that don't get covered much, including from India, including from Pakistan, Bangladesh, Somalia, Ethiopia. So we looked at American women, we looked at British women, but we looked at every country. We said we can't have a bias just for developed world, right? And we obviously found that the women of color had to fight more, had to fight even harder. Uh, so we have a database, and in fact, anyone who wants to now convert them into around 1,000 research papers on those women scientists, and not just research papers. We want to create a web page on each woman scientist and a book, an audio book, an ebook, and a printed book on each woman scientist. So Ioncure has actually a massive amount of data on women scientists. We want to be proud of the fact that one day, I don't know right now whether we can boast of having a record of maximum data of women scientists. So that is sort of very closely tied to my heart, what I believe in, especially I'll tell you my mom's story. I mean, I lost my mom to a very bad situation. So that, I wish nobody has that horrible thing. But what my mom was, I mean, she ended up because she still conformed to some typical gender roles. Uh, Despite my father taking the front stage, my mom wrote brilliant poetry. More than 90% of it is still unpublished because she was busy raising kids. She wrote brilliant travelogues. It's insane amount of literature that she has written, which is lying around. And she was a topper all throughout. And despite initially, so there was a big age gap between my mom and dad when they married. My dad is 10 years older than my late mother. So my mom used to be in shadows and very impressed by my dad. And my dad said, you should get a PhD. But when she got a PhD, she ended up doing so much better than my dad could ever do. So I've always been in awe and I've always seen the unfairness because she got less than 10% of the credit that she deserved for such an amazing work she did. So when I founded Ioncure and I registered it in February 20th, 2020, essentially it was a consortium of scientists which I was leading and I put it in form of a company. We said that we cannot fight COVID-19 crisis, which was emerging without there being a company. That's how it was formed. And I wanted to form it in US, but then there was already travel issues. So I said, let me form something in India and then we'll deal with something in the US a few months down the lane. The first thing I initiated was this women project. So I thought instead of just doing some namesake corporate social responsibility, giving some 1 or 2% money to some charity, the biggest social responsibility is to lift up women scientists everywhere, not just India, every place where women need help. So that is the project we started and we are looking for people. So people can contact us not just for drug discovery, they can contact us for writing these research papers. So I'll end this episode by saying Ioncure is always looking for more members. We believe in citizen science. We believe in volunteers coming working for us. You can reach us at contact@ioncurerx.com or volunteer@ioncurerx.com. Our website is www.ioncurerx.com. Even though we are a for-profit company for 3 missions for drug discovery, I mean, even for the mission on women, we are obviously not making a single penny, but at least not so far. And if we make any penny from the women empowerment thing, we'll give it to some women organization or put the money back in the right cause, maybe through programs in our own company of teaching young women scientists in high school or college about drug discovery. So what we have been doing for SARS-CoV-2, for depression and for epilepsy, whatever is the returns are coming in, they're going in as salary of researchers, they're going in building infrastructure, they're going in for development. No money, not a single cent is going to CEO, which is me. No money is going to founders. I happen to be the founder also of the company. So no money is going to financiers of the company either. So all the money is just being put back in. So we are operating like a not-for-profit for these 3 diseases, because 2 of these, epilepsy and depression, are very close to my heart. And I'm seeing the world being ravaged by SARS-CoV-2. So we want to do the best we can. And I think right now, the real heroes are people who are experts in epidemiology, who are experts in public health. And bigger than them, maybe I'm being smug about it, are drug discovery and vaccine researchers. So I think if somebody is going to beat this pandemic, it's going to be us. So we want all of you to join us and let's make a difference. Thank you, Vanshika. It was very inspiring. Thank you once again.
Thank you.